How is Helicobacter pylori detected? It has invasive test and non-invasive test. The invasive test is related to endoscopy, collecting of stomach tissue during the procedure to test for H. pylori. Non-invasive tests include urea breath test, serological test of blood, and antigen test of stool. Let's compare these tests in terms of following part. The first is sample collection method. Among these, the breath sample is the easiest method. The second is the ability to distinguish active and past infections. Urea breath test and antigen test are active tests. It can be used to evaluate the effect of therapy. Third is accuracy for diagnosis of H. pylori. Among this, urea breath test has greater sensitivity and specificity than other non-invasive tests. So in the clinical setting, the urea breath test is stand out as the golden standard for H. pylori diagnosis. Let's take a closer look at the golden standard, urea breath test. It has carbon 13 or 14 UBT test and our Ultrapeace UBT test. Firstly, look at carbon 13 or 14 UBT test. When you're infected with H. pylori, which has urease on its surface, if you drink some urea test solution, the urease will convert urea to carbon dioxide and ammonia. But we also exhale carbon dioxide in breath, so we give the carbon atom a label, which is carbon isotope 13 or 14. So that we can detect the carbon 13 or 14 labeled carbon dioxide to diagnose the infection of H. pylori. And then we look at Ultrapeace UBT test. The chemical reaction is same as carbon 13 or 14 UBT test, but the difference is Ultrapeace UBT test detect ammonia instead of carbon dioxide for diagnosis. Carbon 13 or 14 UBT tests normally use GCMS or IR spectrometer for detect. They're big machine and need be used in lab. Ultrapeace use electrochemical gas speech sensor. The meter is small, just hand size. It's portable and can be used on site in clinic. Help the doctor to get the result instantly. How the Ultrapeace work. Ultrapeace UBT test. It uses gas speech disposable strip to test the ammonia. This is electrochemical strip, which is in the breath collection bag. Here is the structure of the strip. Bottom is ammonia sensor. There are a gas exchanger layer and a moisture absorption layer modified, which help to absorb ammonia from breath sample. Ammonia is basic. We can get the concentration of ammonia according to pH value. More ammonia, pH value higher. Let's draw a chart of pH value to explain how to get the result. Number 1 baseline is the pH before drinking urea. Number 2 line is the pH after drinking urea. If the result is negative, it means ammonia level before and after drinking urea is almost same. In another situation, also, this is number 1 baseline. If the number 2 post-sample line is go up, it means the ammonia level is increased after taking urea. So the test result is positive. Let's make a summary of Ultrapeace UBT test. It is non-invasive and comfortable and easy for sample collection. Because it used normal urea, it is safe for kids and pregnant women, no radioaction. And it has high accuracy for clinic use. And you can get result within 30 minutes on site in clinic. Ultrapeace, your good choice in clinic for H. pylori diagnosis.